Alright guys, hello there. How are you guys doing? Welcome to the stream. This is on Twitch, and if you are watching on YouTube as well, we're gonna do another episode of Project Hospital. I did a couple of days gameplay, a couple of game day gameplay, offline while I was doing something else. I couldn't stream at that time because there was no, you know, the I just couldn't, there was noisy and all of that stuff. But um, I will show you in just a second what you've done. But let's actually, how about if we actually get to it? So let me get rid of this one, and let's just go like this, and we're gonna actually jump into it. As you can see, funny enough, my follower number actually jumped down from 2094 to 2093. Doesn't matter if you are here. Please follow me if you feel like it. If you are watching the YouTube video, I am trying to get to the magic 1000 number. So if you can help me with that, I would appreciate. Just subscribe, like, and stuff like that. If you want to support the channel, you can actually do by donation on both platforms or even on bits and whatnot in stream. There are some more options to do it. Okay, anyway, so let's actually go, and the title is Before Crazy Day at Traumatology, and I'm gonna explain it to you just 1 second once we are inside. I like this music actually. It's kind of growing on you. Alright, so here it is. First of all, as you remember, in the last time we actually built up our little, neurology department, right? And then we ran one day with just the doctors. And I ended up at that time, because I had to take some loan, I ended up like slightly short, right? I ended up like 19,000 or 18,000, so I couldn't pay back the loan. So I actually played another day just to play, so that I can get rid of that loan. And guess what? I got a patient that had they couldn't find out what was wrong with him. So it turns out that we needed this little thing here, which is the CAG room um, for the radiology department. So I got that one, and it's bloody expensive. It was like $35,000 or something. So I ended up having to take another loan, and I actually did I think 2 more days um, without, like just running through it. But the good thing is now we are already paid back. As you can see, this was the day yesterday, we actually ended up making a profit of like 12,000. Um, Obviously, we had to hire a guy for that. Okay, so it wasn't a great day. This couple of days, the previous day, we made 19,600 something, 16,000 something. So actually, we are making money if we are just running the game itself. However, normally it runs better when I am actually running the show. Now, the other thing that is interesting is I haven't actually played anything in neurology. So it's been just by the doctors. I got 2 fairly decent doctors in neurology. Here I can show it to you. Neurology, there you go. We got Patricia, who is 91 in neurology, which is pretty good. Advanced diagnosis only 6, but diagnosis 76 and general is 86. So it's an overall pretty good doctor. And the other one is decent, is 62 in neurology, which is okay. General 74, diagnosis 68 also has an advanced diagnosis 4, which is still very important most of the time. So yeah, I think it's been okay. Um, Neurology, yeah, we have a janitor who could be sent over to do the shop, and we have a receptionist who is not so good, but so far so good. All right, so that's what we had. Now, at the end of there was one of these days they actually had like 25% less people coming and this and that, and now we have an issue when a renovation to a nearby clinic causes 40% more patients to come to the traumatology. Okay, which means that normally the department actually we had critical load. I didn't even realize that. Okay, so apparently we had critical load on neurology last time, which means that probably it seems like we need one more neurology office. However, I don't dare to do it right now because this time the traumatology, which is here, and also we only have two offices, they said they gonna have an extreme increase, 40% increase. Although last time yesterday they were low and medium, so I'm not sure if that would be a huge issue, but it's kind of scary if you know what I mean, you know. So I'm thinking of preparing for this 40% more patients by possibly opening one more office. However, what I'm gonna do is I'm gonna go back and get back again all the control in the whole hospital, which actually, honestly, the way I like to play it anyway. Okay, and then I'm gonna start playing, and if I see that it's really too much for one of these two departments, both of them are gonna have to pay attention at, then I might just simply open maybe one of each by the time I'm gonna get some money. I could open at least one of them right now. I think it's about, let's see, a room in let's say traumatology is 5,200 and one in neurology is 5,000. So 10,200, like I could exactly open two of them. Of course, when I hiring the doctor, I have to pay like extra 1,000 for a little extra information and everything. That maybe wouldn't fit that well, but other than that, it would be pretty easy. However, don't forget, when I open an office, I also have to get some little gadgets like these TVs and the check-in machine, whatever. So it's not exact. So what I'm thinking, should I get one of them first, and then let's see. Actually, let me see. Yesterday, you see, we didn't even have a critical yesterday in the emergency, which is good. They are starting to get some load off them. Uh, Internal medicine is very low, so I think once we have hospitalization, our internal medicine is going to like grow up. We're gonna have more patients. I don't know. You know, it's a little bit. It looks like that this game is like catering what you have, and it's gonna give you based on what you have. If you open, for example, the hospitalization, your patients are gonna start collapsing left and right. No question, no doubt about it. I've seen it many times. I've got such a big hospital already. I have 72 patients coming in every day. Never, nobody is collapsing. Okay, probably because they know that I cannot treat them. I cannot do anything with them. So nobody is collapsing. Once I open up this thing, they're gonna collapse like crazy. I promise you that. So it's a little bit like when somebody goes to the hospital and says, "Hey, you know, what is my problem?" He says, "Well, it looks like you have, I don't know, you have cancer." And then the guy says, "Yeah, but my cousin went to a hospital, they said that he had cancer, and then he died of a heart attack. He says, "Don't worry, sir. If you come to us and we treat you for cancer, you're gonna die of cancer." So that's how this hospital kind of operates at this moment, and it's good and bad. It's kind of like for example, when there are a lot of different possibilities of the diagnosis, but almost all of them are from a department that I don't have. I don't even look at that. I mean, I'm supposed to, but I don't even really have to look at that because I know I'm not gonna get that sickness, okay? Which is kind of it's not realistic. So I'm not that happy about that one. But other than that, it's whatever. So, should we do that renovation and traumatology? Because we had very little actually. So the very little plus 40%, would it be like really a lot? I am not sure. Okay, but we had critical here. So I'm thinking, why don't I actually set up first just this one and watch out for this and get one more if I need it. How about that? So let's get our neurology because that was where we had a critical load. Let's actually get them one more office. Okay, neurology office. Here, there you go. Now we're gonna have to have this little thing here. Cannot put it here, cannot put it here. Oh, that sucks. Come on, guys. Okay, you know what? We have to move this thing a little bit so everybody moves once. One. Sorry, first you. Where are you? Here. Oh no, but then okay, hold on. Okay, you just go like here, okay? You definitely be safe over there. We don't have to see that anyway. Okay, and then you go one, sorry, one, 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 and now we should be able to put our little thingy here. Yes, we are, and the TV right there. Perfect. So we are done with that, and obviously we need to hire a doctor. Now that's the scary part. This guy, neurology. I would like to have. Oh, neurosurgery. Okay, so now it starts giving me people who have neurosurgery abilities. However, here's the problem. Well, we have differential diagnosis with the others quite a bit. So, yeah. Oh, and this one doesn't have any unknown things either. However, I'm still gonna take a look here. Okay, so we definitely wouldn't want either of these. This one is a mean guy. This one is an alcoholic, so forget about it. And this one has stinking feet. Oh, no, yeah, stinking dirty feet. So everybody's annoyed by him, even himself. So I think it's obvious that this is the person we're gonna get. Thank you. Welcome to the hospital. And now we are only have 4,000 antis dollars. That's fine. So now we actually gonna start. Let's get one more water bottle. Let's just copy that. Hold on. No, let's just copy that. That thing. Yeah. Just put it somewhere. Not here, not here, not here, not here, not here. Here. Perfect. Okay, so let's just start the day. However, as I said, these guys, I'm gonna handle everybody, and especially as I said, I want to actually look at the neurology department because I am interested in how things are working there. But okay, this person is already there. But the traumatology is tested this time, so we keep an eye open, and if necessary, get some more doctors over there. All right, let's just open the doors, guys. All right. Let me just make sure that you guys hear me and everything is on. That's right. Okay. Okay, good. Because I did one game when I had a stream when I streamed Ostriv, I believe, and I didn't turn on my microphone, and that was really nasty. All right. So at least you guys have some nice environment and everything. Where are you going? You just got here and you're already taking a rest. Fine. Now let's see. Are these people not that happy right now? They have some little unhappiness. Alright, let's see. People are coming in. I'm gonna go close up here because this is my neurology, but I'm actually gonna be jumping from patient to patient because I am taking care of every single patient right now. So let's see. The good thing about it is that there are not going to be unnecessary x-rays and this and that, so we're going to be look at that. People are filing in. Apparently nobody has come to the neurology yet. Oh, somebody's already showing up here at the... Oh, that's cool. So we actually already have... And this is the guy. Oh, no, this is not the guy. Peter Davis, Charles Miller. So let's take a look at Peter Davis here. No, no, hold on. Which one is the one that is Charles Miller? No. There is somebody who is like not necessarily dying but having some serious issues. Where can I think I have to take a look at here. Yeah, it says Peter Davis. That's weird. Oh, and by the way, we haven't done this one when we actually treat all patients with specialist mode, and I'm gonna do that sometimes later. For now, this is just good enough. So, okay, this is an easy first customer, kinda. Let me put it like here, maybe. About here, okay? So, kind of easy customer, first customer, because we already know what's wrong with him. So let's actually take a look what he has abdominal pain, not too strong, and vomiting. So we don't know if he has a fever yet. Let's check that out. Now, we're not going to have a lot of patients apparently here because we still only have 72 people here. 40% more in one department means a little bit less people in the other department. So whenever it's not traumatology, I'm going to be a little bit more relaxed with the people. So what do you have? You have nausea that would come out in a physical, but I believe we already know that you have because you're vomiting like crazy. He would have to rest if he has malaise. Okay, general feeling of discomfort, unease, and sometimes pain, but it's not that important. And he could have this would have antibiotics, but that's actually what he's getting. So you know what? Let's get him the temperature measurement just so that we know it. Hold on, we actually want to see it. And look at that, we are still at this guy, so he does, oh yeah, he does have fever, alright. So we already know everything. I don't think that we need any more physical or this or that, so we're just simply gonna diagnose it. I like to do it myself and let the doctor decide what he's giving him, and we are basically done with one customer. Okay, this one came yesterday obviously already, and he did a microbial cultivation, and it turned out we know that he have conjunctivis. Okay, all we have to do, because we already have everything, we just simply let the doctor treat them, and we got this guy covered. Alright, James Jackson, you had some rash. Okay, now what do we do with that? We have, like, look at that, all these possibilities. What could your problem be? Which right now I'm trying not to concentrate on, because we have to first, like, kind of come down to some easier way. Actually, when I use the, what is it, expert or whatever mode, there's one more, specialist mode. Actually, I can't even see how many hidden symptoms you have. Now I know. So anyway, if you have some rash, I like to give them some, I'd like to do some tests that I can do as a doctor myself quickly without sending the person somewhere, because then they have to wait and all kind of things. So, and by the way, if I do just one, it's gonna stop anyway when I finish. So it's not, it's doing it one by one, which is, by the way, some nurse was on some comments of this game in some other video, not on my video, but I watched some other people's video, and that nurse actually mentioned that, yeah, that's kind of weird that they do one by one every single thing instead of just simply doing it like once, like just putting the measuring the temperature while, for example, looking at their throat. It's absolutely possible, and they don't do it. They do it one by one. So if I just choose one thing here, it's just going to make me more tired because I have more pop up, but at the same time, I can guarantee that I'm not wasting time. Okay? Anyway, if we have physical, I don't even know what else we should do. Let's do a temperature as well, because that's like always happening, and the rest we're gonna take a look later based on what I just told you. Okay, neurological. Finally, we have a neurological person, patient. So he might have blepharitis, is an inflammation of the eyelid, hyper, hypertensive retinopathy is damage to the retina and retina's blood vessels due to high blood pressure. Okay, so an inflammation, high blood pressure, and cluster headaches are extremely painful, often with crying and a dripping nose that only occur on one side of the head. Huh. So we could actually check your blood pressure. That would actually make sense, right? Um, we should do a physical. I mean, no questions about that. And what is that? Apparently there are some things I cannot do that in neurology I could, but they are only available in some neuroexam unit. Neurology, what is it? Yeah, neuroexam unit. Now let's take a look here. When we are in neurology, on the clinic itself, there is no such thing as neuroexam unit and cardiology. Uh, no, there is no neuroexam unit, okay? Minimum staff 1 technologist, minimum room size 5 times 4. For required equipment, click the room marker on the floor. Let's actually take a look how it looks. Neuroexam unit, I'm not gonna actually do it, but yeah, it actually looks like a doctor's office, to be honest. Doesn't really, it's not really different from there, right? But they have some weird looking computer on there. Looks like it's not weird looking, it looks like an old Apple computer or something. Other than that, like, really nothing. There is that thing on the table, some kind of a thing. I'm actually thinking, Should I invest in one of them? Because we probably don't need that much here. If I have a neurology unit, that one here could possibly help me. But so far, I will wait until I actually need it. If I see that I needed it and I didn't have it, and it caused me some trouble, then I will do it. So for now, we do a blood pressure, we do a physical. Let's start a blood pressure. We can actually see here, and neurological testing is always okay. It's just some questions, different simple and specific questions and tests. Okay, let's just start with that. Um, physical. Yeah, physical should actually let us know if he has a headache, although we might need an MRI at the end, but that should be fine. So let's just do this. Alright, let's go here. Okay, we know exactly what you have. That's always good. However, we can still get some more extra things. For example, if you have otalgia, you would need some analgesics, some pain medicine. We always do basically an ear. Temperature I don't need because we already have, and an odometry. Pretty much that's what I always do. Physical, yeah, we should do a physical as well because that would treat him for edema. Now again, take a look at that, guys. Now we have already a lot of people here, right? One is already critical. Now that's funny. That's funny. Um, why do I already have one critical room here? I really don't know. We have 5 people for 3 doctors in neurology. I don't know. I think that should be enough, but maybe I'm wrong. So let's see. We have, look at that, not a lot of emergencies. 3 general surgery ones. We actually have 2 or 3, I don't know. We only have 2 people here. That's very few. Orthopedia, we only have 1. Neurology is fairly more. It's 5. So that's what I'm saying. I got that extra one to take care of that. Traumatology is so far only 2. So no worries. I'm just gonna do all these things. We don't need a temperature because we have already no need for differential diagnosis. We're gonna figure out what's wrong with you. I mean, we already know what's wrong with you, but we're gonna make sure that you are treated for everything that's necessary. Now, orthopedia and traumatology should have more people come in, but actually, apparently, they say that traumatology is gonna have the extra people. Look at this. This guy, again, this girl or woman, we already know what's his problem. Okay, but a ton of things that we might have to take care of, okay? So let's actually start with that. We're definitely gonna do a physical. We're gonna do a chest and the neck palpation, and we're gonna have a temperature. That should take care of pretty much everything, hopefully. Okay, I think this is when my new little game thing, angiography, came in. Okay? An imaging method used to visualize the lumen of the blood vessels and organs, particularly the arteries, the veins, and the heart. This was, I remember that yesterday the guy who couldn't be treated basically had these. Okay, so he has eye pain, photophobia, he cannot tolerate light, and blurred vision. Okay, so we already have those. We still can do a basic physical. At least we know that it's definitely a neurology problem. Sometimes they come to a department and they actually have to end up going somewhere else, which is kind of cool. Interview would have said if he had not vomiting, so he doesn't. Tonometry. Okay, we cannot do tonometry and perimetry because, as I said, Let's see how it's gonna cost us. If we really have to, I think I'm gonna get a neuro exam unit. How much is that? Hold on, I didn't take a look at the price. A neuro exam unit is, ooh, it's expensive. It's $10,000. Okay, hopefully we don't need that. Let's just forget it for now. Okay, we do a neurological testing, that's for sure. We can do, okay, we can do this one though. Is an eye examination used to evaluate the drainage system of the eye. Okay, and this one, fundus written visualized through. Okay, so why don't we do that first? We can actually do. Oh, this is a medium level. This was discomfort, none, low, and low. Basic visual test. Do we still need to do that? Like, I don't know if we need a basic. We already see that he has a blurred vision, right? So no. Differential, too early. And geography, we might need to send him. So, but it's low. Okay, it's not a big deal again. And that one is probably not busy right now. So let's just do first this one. Oh, we know that a copperhead snake bit you. Nice. Okay, do we have like a very high thing right now? We don't have a big. You don't have too much big problems right now. You have some. You might have some pain, whatever. Let's do physical. What else do you need actually? Physical chest. Yeah, you might have some issue with that. Hypertension. Alright, let's just test your blood pressure as well. Optimal, we don't need that. We actually don't even have that. So let's just do these three. And let's remember that here we're gonna have a ton of people coming to traumatology, although apparently they haven't really shown up yet. Only 2 people. Or are you telling me that since we had so few people last time, it's actually not a lot of people? Could be. Alright, so we also have this guy, Mobiasis. Okay, let's see how we are doing. 32 people right now in the hospital. Out of them, how many are here? Yeah, it's kind of building up. And look at that, nobody's here, right? And we have 3 doctors. So, sir, I think you need to go over to the other department. Thank you so much. And let's see what you might just want to do. Do I need a physical? Not really. I mean, if you really want, but let's actually do this because they have a lot of time. So, physical and temperature, but please go over and leave us alone here. Okay, so he's leaving the room right away. Okay, this one is subload and orthopedia. I'm looking at it and I know it already. Again, orthopedia, sometimes they get busy actually. So we shouldn't be, yeah, no, they are not busy right now. So, sir, foot injury and pain, medium everything, so it's nothing, he's not dying or something. So why don't you just go over to there and do a physical? Yeah, just a physical. Yeah, exactly. Just do a physical and then they're gonna take care of you. Okay, now this one looks interesting. By the way, we still haven't got any money yet because we are treating one by one. General, infectious, infectious, infectious. Now, this is what I was talking about. I don't have an infectious disease, so I could just simply click on it that, yeah, this is the problem, okay? And I would be right. I'm absolutely guaranteed. However, let's kind of role play it and let's see what we would do. We would definitely do a physical and we would do an abdominal. I'm not sure. Actually, we should do a temperature because if it's really high temperature, we have to pay attention to that. And this, if we have this part, we would have a chest. Okay, that should be enough. Very quick and very easy. No pain. Okay. You have sleeping problems. That's pretty vague if you ask me. So let's do a physical. Let's do a speech listening. Let's do neurological testing. Okay. And let's maybe do a chest or a temperature. No, let's just go like this. Hopefully it's gonna narrow down and we can decide what we do. Okay, we know what your problem is. Awesome. We already knew it, and let's see what we figured out. Yeah, you have trouble rising, tenderness, fever, weight loss. You have all the trouble in the world. Oral cavity inspection would give you NSAIDs. Physical we already did. Blood test wouldn't give you actually anything. What's the point? And you are going to get the corticosteroids. So why don't we do an oral cavity? Oh yeah, we already did a temperature as well. Okay, so let's do an oral cavity test and we're gonna figure out what's wrong with you. Okay, foot contusion or bone fracture. Now this is like a classical thing that needs a combination of physical and differential, and normally that should be enough. Okay, same here. We have all these problems possibly with the arm. I'm just gonna do a physical and a differential, and normally that would take care of. I don't know. Although his differential is 0. Okay, you need to do it. Your differential is like 37. Okay, then I believe you. Okay. Arm injury, probably you should have done a bandage first, but whatever. Oh, okay, you're back. No, this is a new one. Actually, it's a traumatology problem. So why are you coming here? Can you please tell me that? I mean, it doesn't really make a lot of sense. Look at that, we already have 2 people waiting here. Only 1 person waiting here. Alright, he already has some vomiting and breathing problems. That's actually kind of scary. Physical. Okay, let's do a quick physical, and then we have to like give you all the others. Okay, hopefully you're not gonna like die on this, right? You're not gonna collapse or anything. Okay, this one is at least at the correct department. Orthopedia. Oh, and we have 1 person finally got out of here. So what do you have? We already had a physical. CRP level high or something. We didn't do it, but we already give him an NSAID, so no need. Temperature we did measure. Physical blood test. EMG would give him the cortial. Okay, so you know what? You're already gonna get this anyway. So why don't you just go and get it? There you go. Actually, I'm gonna help him a little bit. I'm gonna give him some diet because I basically give everything that is like medium. I like to choose 3 doses, But whatever is low, I just ignore it. Okay, so let's go. Oh, it's still the same guy. Look at that. So blood pressure, physical and neurological didn't help you, huh? Okay, now we're gonna go and ask him to do. Oh, wait a minute. Yeah, that's the one. So angiogram is not an option here. That's kind of weird. I would have expected that an angiogram would work help here. I don't know. So, okay, if you're a doctor and you hear it, you're probably holding your head like, what the hell are you talking about? Okay, so let's see. This one, physical, physical, neurological, which we did, physical, physical, tonometry. We cannot do that. Microbial and basic visual test. Okay, let's do a basic visual test first. Oh, he has just swollen eyelids. Okay. I don't remember doing with, you know. Anyway, so we do that, and it's very easy to do this. It can actually do it in the room here. So let's do those two, and then come back to it, and let's see. Because when we done, as I explained, when we are done, he is not going to go away. So it's okay. Dermatom dermatomyositis. Dermatomyositis. I cannot even say this thing. That's why I wouldn't be able to be a doctor. How could I treat something that I cannot even say the name? Now, apparently, we already got some things like we got the hoarseness, so we're gonna give him some NSAID. So, what else do we have? Interview? No, no, no. Yeah, we're just gonna hold on. Muscles inflamed? Yeah, that's what we're gonna do. Yeah, it's actually inflammation of the muscles. So, let's just. Okay, but it should be orthopedia. So we should have sent it over already, but that's alright. It's just some medicine, so let's just let this person treat them and go away. That's fine. Rabies, asthma and insomnia. So speech listening let us know that he has anxiety. Neurological and physical didn't tell us anything. Okay, we need to do a temperature test. We need to do a chest escalation. And I believe we should do a thorax for here. For now, like this, okay? Okay, rattlesnake bite, we already know that, and we did a physical, nothing else is wrong with you. Should be actually traumatology. So again, why are you sending the traumatology people here? I really don't know. Actually, we cannot even treat him here, as you can see. So he has to go to the traumatology because we don't have any antivenom. So once you go there, just treat him. All he has to do is get the antivenom and maybe some other stuff, bronchiolitis. Okay, I'm gonna make sure that he gets the extra, because sometimes they don't, you know. Okay, so I'm also gonna give him the stomatics, and the rest is up to the doctor wherever she goes. Okay. Neurology again. Keratitis bacteria, conjunctivis bacterium, and blepharitis. Inflammation of the eyelash, pink eye. Inflammatory also, the clear dome surface of the eye. We already did that physical. We did all of that. Okay, let's try a differential diagnosis. We are still early in the morning. And let's see where we are going to go. Okay, sore throat, breathing problem, physical, chest, oral, temperature. I think that's enough. We got irritable cough, fatigue, chills, headache, fever. Okay. Let's do a physical and the chest. Maybe a thorax. Alright. Okay, we know what your problem is. You are in the right department. Just treat that poor man. I mean, was it a man or a woman? I didn't even look. Okay, so we already did physical, chest and blood pressure, and we actually managed to make sure that we know that this is just this guy here. What do we do with her? We don't need... We cannot do any of these, so... Or we don't need to, so just treat him. Thank you. Nail fungus, athlete foot. Okay, physical and do a differential. Normally that would figure it out. Okay, look at this. The differential diagnosis with the physical actually managed. There were 3 of them. We know that it's only that. We still have one hidden symptom though, but we could only do something with the X-ray, and I don't want to do that. We're just gonna treat him. That's it. Okay, campylobacteriosis. Campylobacteriosis. That sounds really nasty. We already did a temperature test, so he doesn't have that. We did do a physical, nothing came out of it, no headache. So, okay, an ELISA testing would give us antibiotics, but we already didn't give him that, so why don't we just simply treat him? Okay, you know what? Let's take a look at the general surgery situation here. Orthopedic is still very few, just only 3, and we have here actually not so many people. Traumatology actually is getting a bit busier. Neurology also. So we kind of have to pay attention. It's only antibiotics, you know. If I send over, it's not gonna really help save much of my time, so just gonna go. Oh, sorry. Antibiotics, antipyretic, okay. Analgesics, no need. Antipyretic, okay. Analgesics, NSAIDs. So it's a medium one, so I'm gonna give him the NSAIDs as well. Alright? Okay, let's go to this guy. Urinary tract infection, we already know that. So what do you want? We already tested all different kind of things yesterday, I believe, and we ended up with this. So interview, urine test analysis. We haven't done that. We should have. Maybe it's cloudy. Rehydration for different strong smell. Okay, you know what? It's still morning and the lab is not so busy right now, I think. So let's just do this. Please check if you have some problems like that. Okay, you have asthma. Now with asthma, we should do an echo. Shouldn't we? No, we're gonna do a spirometry. Thorax, chest. We already did the thorax. We already did the chest. Now normally we should have a spirometry. What is interesting is that Oh no, that wasn't asthma, sorry. The echo would be needed for the, what is it, diabetes. Okay, never mind. So spirometry is only in internal. So let's go, you go over to internal and do a spirometry. What would it actually come with? Hold on. Yeah, bronchodilator. So we might need that. Oh no, asthma is gonna give you that anyway. So forget about it. Hold on. No, 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 no. Where are you? Here. Sarah Martin. Okay, sorry about that. Just come back. Just come back. And just stay with Sarah Martin. Yeah. Where you are. Sarah Martin. Yeah. Don't go anywhere. Just give him the bronchiolitis and that's it. Not going to chair, you idiot. Um, I don't know how to treat these people. Like, come on. Well, I kind of messed it up. Sorry about that. Okay. Antibiotic. Both of them. Inflammation of the eyelid. Both of them inflammation. So, what's the difference exactly? I think we're gonna have both of them. Basic visual wouldn't even do anything. Tonometry could do something, or microbial and tonometry. Both would have hype. Okay, so it would be the same. That microbial would actually cultivation of the subtype. It would bacterial blepharitis or this one. So we really have to do a microbial sampling. All right, then just do it. Fine. Okay, hypertensive retinopathy. We already figured it out. Okay. Now, so that thing, how did I figure it out? Basic of, yeah, I just, I don't know, I just did all this testing. So, what do we have? We probably need to do an ECG because we don't want him, basically we have to make sure that we don't do any of these. You know, if we know about any of these. Visual field limited, perimetry, that would need the neuroexam room. Okay, that's bad. Physical, we already did. Okay, antihypertensive, no, it's AC inhibitor. It's a different thing. Is it? I think so. Blood pressure, we already checked, right? So we don't need that. Okay, that's good. Blood test, no need. So we should do an ECG just to make sure. And this one wouldn't even help us, so let's do an ECG. Simple fracture, arm contusion. Okay, we couldn't figure it out. Okay, even she couldn't figure it out, so that was totally useless to send this customer over to this experienced doctor because the experienced doctor couldn't figure it out. So the only thing we can do is an X-ray, and by the way, our X-ray guy is pretty boring because we haven't sent anybody to X-ray today yet. You know, we're controlling everything, so it's normally by this time the X-ray and you know, some of these are all overwhelmed by some people. Today they are not because we are the ones who are handling it. Okay, so when you have A and B, you could do a nasal cavity and an oral cavity inspection just to see if you have nasal drops necessary. But okay, let's do a nasal and let's see if a differential diagnosis would work. Although with your 0%, I don't think so. But anyway, it's still early, so we're gonna send him probably serological or whatever it's called, serologic sampling, and it's gonna help him. But that's all right for now. Okay, we already know what your problem is. We don't need you to do anything more. Just treat the patient, please. There you go. And we already have 7,065. I'm kind of looking at this neuro exam office. I'm kind of thinking, do I need that? Okay, let's take a look again how we are with neurology. We have 5 people. How many are here? 5. Treated, waiting. So far, so good. I just want to make sure if we are really busy, we can actually already get one more office, if necessary. For us, it's the same because we are treating every single patient. But for the patients, it would make a big difference. So neurology, you have a red eye, and you have already did 3-page worth of shit, PCR and nasal and everything, and you still don't know what his problem is? Okay, that is kind of annoying. That is kind of annoying. We cannot do any of these. Discomfort low, discomfort low. Which one should we do, guys? Or each of them? No, I don't want to do each of them. So we really none of these actually would work, so that's fine. Vein, heart, whatever. I don't think so. I think we would need an MRI, honestly. Let's do an MRI. Or, who is this person? Oh, 3%, never mind. Let's just do an MRI. Hopefully that's gonna help. Look at that. Photophobia, okay. We do need... I'm gonna do a physical, but a neurological for sure. We do have possibility of fever some places. Basic visual test or photophobia is, let's see again, inability to tolerate light. Okay, so I believe this would help a little bit. Check out her eyes. Okay. At least foot. Okay, you're done. Fungal antifungal ointment. You're already getting that, so just go and treat this patient. Okay, this patient is... He has a chest injury and a breathing problem, so let's give him some emergency and bronchiolitis right away, because he is really suffering apparently. And then we're just going to do a physical and differential, okay? But obviously first we do the emergency care and then we do any kind of physical. Alright, guys, we haven't got too far, to be honest, and that's what I was afraid. This way, the way when you are playing, especially as I said, you know, it's a new department, this, what is it, neurology, no, yeah, the neurology department is a lot of new things that I kind of have to figure out what possibly causing things. So, right now, I am playing it probably way slower than I could, technically speaking, but that's okay. I am going to, hold on, here's some breathing problems. That should be alright. So I am going to just stop here for the moment. Okay, let's actually do physical as well. And so I'm gonna close it here, guys, and we're gonna continue it next time. As you can see, we have made some little money, not a lot. We made 4,680 so far, but it's only 10:30 in the morning, so it's really just starting. We don't have any loan right now, so if we really need, I could actually get one more of neurology, or not neurology, the traumatology office. But for now, let's just see if we can go through the day without that. But look at that, we have to have a lot of exams and everything. We might have to do that. So we'll see tomorrow, not necessarily tomorrow, in the next episode. And if you are on Twitch, please follow me. If you are on YouTube, please subscribe, like if you like the content, hit the bell, and you know, maybe comment. Let me know what you like, what you don't like, how you like the quality, and um, I would like to get to the magic 1,000 subscribers. So if you can, guys, help me with that. Other than that, I'm gonna just save it here. Okay, and this is like grinding. I'm just putting grinding, doesn't really matter what I'm putting. And we actually just gonna uh, finish it here. I'm just gonna go and say goodbye to you guys, okay? So come back next time, and bye bye.